Hello, everyone, and thank you for tuning in to the HPHR Journal Insights podcast. HPHR Journal is an independent academic referred journal that seeks to improve health equity and social justice through the publication of content grounded in the thoughtful evaluation of evidence. It is published by the Boston Congress of Public Health, BCPH, a nonprofit organization that addresses social change at the nexus of public health, health equity, and social justice. This podcast delves into articles published in HPHR Journal that addresses complex public health issues in an effort to affect social change. My name is Riva Bajuri, and I will be your host. Today, I'm joined by Dr. Lorenzo Hopper, author of Fathers and Child Behaviors Assessing Father Engagement, Early Childhood Diet, and Screen Time in a National Sample of U.S. Children. His article can be found in HPHR Journal edition 36, available on hphr.org. To start off, please introduce yourself, your professional background, and the content of your research.
Hello, Riva. Thank you for having me. As you stated, my name is Dr. Lorenzo Hopper. I'm an assistant professor in the Department of Public Health Sciences at the University of North Carolina at Charlotte, where I teach at both the undergraduate and master's level in public health. I teach a range of courses, and primarily I'm teaching behavior change theory and health education, health promotion. I joined the department back in 2016 as a part time adjunct and then as a full time assistant professor in 2020. I received my educational training at the University of North Carolina at Chapel Hill in the Gilling School of Global Public Health, where I completed my PhD in maternal and child health in 2020. My research interests are in maternal and child health and the pursuit of health equity. So, working with communities of color through community based participatory methods. And I try to take a unique angle in that centering fathers in the conversation of how to improve maternal and child health outcomes, not only for mom, not only for baby, but also what's the impact that fatherhood has on men's health. So those are just a few of my research interests. And today I'm here to share a little bit about my research exploring father engagement and early childhood health behaviors.
Awesome, thank you. Would you like to explain why you chose your specific topic for this article?
Absolutely. It goes back to my upbringing, really. Coming up in a single parent home, I always, thought about how my experiences may be different than, some peers who grew up in a two-parent home. And as I continued along my educational journey, I learned about different health disparities that exist. And one that jumped out to me was infant mortality for African American babies. And so I knew that I wanted to pursue additional training in maternal and child health to further explore some of those disparities. And fatherhood for me kind of jumped out as an unexplored area, as one that needed more attention. And so that's kind of what led me to my research interests in maternal and child health and fatherhood. This specific topic, it came over time through conversations, participation at different speaking events, and asking what other researchers thought about the father factor, the impact that fathers have on different outcomes. As you know, obesity is an urgent threat, and it poses immediate and long-term health for and well-being for children and adults, but being overweight or obese in childhood has some immediate health impacts, and they range from increased breathing problems to increased social problems for young children, that can continue on into adulthood. So that's really what led to me choosing this research topic.
Very interesting. Thank you for sharing. Now, when you were conducting your literature review, I wanted to ask if there was anything surprising or interesting you found about the research available on this topic right now.
Absolutely. It kind of confirmed some of what I already knew, which was that traditional approaches to studying and understanding maternal and child health left it didn't include fathers. And so I knew this was an unexplored area, and that was kind of what I learned from the literature is centering fatherhood in these conversations is an emerging area. So there is literature that exists that includes men, that includes fathers. I can remember the first article that I read was entitled "Where's the F in MCH? Father Involvement in African American Families," and that was by Michael Liu and his team. And so that kind of shined a light on fatherhood and the opportunities there. Through my literature review for this specific project, I really paid attention to the results from a systematic lit review that examined the influence of parenting on childhood obesity between 2009 and 2015. And so the researchers, they found that only 10% of over 650 studies actually presented results for fathers. So that kind of showed a gap that this work could fill by centering fathers. Their review also concluded that studies including fathers were less likely to focus on diet and young children. So this is just a limited area where I felt like this project could really fit nicely and set the foundation, set the stage for continued work in this area.
Definitely very interesting. Now, I was wondering if you could kind of highlight why exactly the prevention of childhood obesity is so important and what
Mhm.
that kind of serves as a risk factor for later in life.
Absolutely. So, through my public health lens, primary prevention as much as possible. We know that these are outcomes that we can prevent in a lot of ways. And so, childhood obesity in particular, like I mentioned, there are immediate risk and then there are increased risks down the line. Ultimately, childhood obesity is associated with higher chance of premature death and disability in adulthood. And so, just thinking about the life course perspective, intervening as early as possible, I think is so vital to really controlling increase rates. We've seen child obesity triple over the last few decades. And so I think it's really important for us to understand a lot of the risk associated with children who are obese and the development of non-communicable diseases like diabetes and cardiovascular disease at younger ages. So yeah, those are just some, and why I think the prevention of child obesity is so important. I think it is modifiable, and I think that the earlier we intervene, we have benefits throughout the life course.
Certainly, I totally agree. Definitely cannot be overstated how important childhood obesity prevention is. Now, in terms of kind of the setup of your study, what was your study population and the metrics you
Sure.
used?
Sure. So this was a secondary analysis using the early childhood longitudinal study birth cohort. And this data set was designed to provide researchers, childcare providers, teachers, parents with detailed information about early or children's early life experiences. And so a few of those areas focused on children's health and development and education during these formative years from birth through kindergarten entry. And what really drew me to this data set was they surveyed fathers independently. And from my literature review that I talked about earlier, I found that oftentimes information on levels of father engagement were through the mother as a proxy. But this study had a separate survey that fathers filled out. And so some of the study measures that I was interested in was resident father engagement as the key measure or exposure variable, and then a host of other measures that captured child health behaviors. These were ranging from diet, screen time, and to delve deeper into diet a little bit, fruit and vegetable consumption, sweetened beverage consumption, and things like that.
Now, you mentioned resident father engagement. I was hoping
Mhm.
you could kind of elaborate upon that and how that was really measured.
Absolutely. So, resident father engagement, right? So, fathers who lived in the household, this could be biological father or other father figures who lived in the household, stepfather, adoptive father, things of that nature. And so, the survey instrument that the fathers completed asked a host of questions that got to the types of activities that they did with their child, playing chasing games with their child, preparing meals for their child, changing diapers, different play activities, playing indoors, outdoors, giving the child a bath, and the list really went on. There were, I think, 13 different items that I included in my first analyses, which was to take all of those items and run exploratory factor analysis that pulled out caregiving activities and play activities. So ultimately, I looked at resident father engagement as the amount of time that fathers participated in caregiving activities, the amount of time they participated in play activities, and then how often they ate breakfast with their child in a typical week. So those were like the three distinct resident father engagement items that we used.
Awesome. Thank you for kind of breaking that down for me. Now,
Sure.
overall, what were your major findings regarding the impact of father-child engagement, childhood diet, and screen time on childhood obesity risk?
Sure. So ultimately, we did find some key associations and that revealed both a mix of positive, negative, and null impacts of father engagement on preschool obesity health behaviors or obesity risk factors. So many of the items that I discussed before, with father engagement through both caregiving and play, decreasing juice consumption. On the other hand, father engagement and caregiving, increasing the risk of excess screen time, which was greater than 2 hours of screen time a day. And father engagement in play, predicting lower fresh fruit consumption. So ultimately, our findings suggested that father child engagement is impactful and has both positive and negative impacts, which kind of shines a light on not just participating in the quantity of engagement, but the quality of engagement as well.
Very interesting. Now, were there any limitations of your study or any parts of your study that you would suggest be expanded upon further for future studies?
Sure. Yeah, we write in the paper about a few limitations of the study related to measurement. We were using existing data, so we kind of had to use the data that was available, which there's some limitations inherent to using secondary data. But the challenges of measuring father engagement are pretty well known. There are limits to capturing information from men in this way. And so a limitation that the Eccles B, the early child longitudinal study birth cohort, were that these father engagement questions, only asked about frequency, so quantity, and we weren't able to get at the quality, which we know also matters, and what these findings kind of suggest. So we write in the paper about future works kind of delving into and having better captured the completeness of what father engagement might mean. We also discussed some of the social desirability or the recall bias that may have taken place as well.
You mentioned social desirability and recall bias. I was wondering if you could
Mhm.
just kind of define what those two terms mean.
Sure. So, social desirability. So, in the social sciences, we talk about this as a type of response bias. That, when you're filling out a survey, you may be more likely to report or answer questions that are viewed more favorable by others. So, we're asking fathers to report how engaged they are with these number of different activities, right? And so, we just acknowledge the fact that there might be a little bit of over reporting of the good behaviors or under-reporting of what might be considered the bad behaviors. And recall bias, we're asking fathers, well, they asked for fathers during this survey, how frequently were you engaging in these behaviors over the last month or over the last time? And so sometimes it can be difficult for people to remember, you know, as accurately as they can to recall some of those things.
Very interesting. Thank you.
Mhm. Sure.
Now, overall, how would you say your research relates to health equity and social justice?
Well, that's a great question. I think all of the work that I try to do is, with health equity in mind. And there are a number of disparities that also exist in terms of racial and ethnic differences that haven't changed substantially over time. With the prevalence of obesity being lower among white Americans than Black Americans and other minority groups. And so I think that just shining a light on these health outcomes where we know disparities exist is quite important. I think another limitation of this work was not really being able to parse out the effects by race ethnicity, which I think would have been interesting. But I think that for some of the other work that I'm engaged in, it's certainly important to pursue maternal and child health equity and to keep equity, to keep examining these issues through an equitable lens. And so it's something that I'm constantly kind of asking myself in terms of like, how does my work relate to the pursuit of health equity? And so I think that this is another area where, just starting the conversation for including fathers in the conversation. And then we can continue to take steps towards, prioritizing justice in our work.
Definitely. Thank you very much for sharing that. Now, before we kind of wrap our meeting up, I was just wondering if you had any last comments or a call to action you'd like to share for the audience or other researchers that may be listening to this.
Absolutely. I think that this is, like I said, an emerging area that could use much more kind of focus and the inclusion of what I would call family based, right? Thinking about the role that others play. We use an ecological perspective to understand that these are like complex interactions that all lead to health behaviors, especially for children, especially in early childhood. And so, centering parents, including fathers. This study, one of the biggest limitations was that we only had data for resident fathers, so those in the household, when we know that a lot of family structures look quite differently. And so non-resident fathers, prioritizing work in that area, I think is so important as well. And thank you all for creating this avenue for sharing work and a place for researchers to disseminate their findings. Because I think too, like it's not just about doing the work, but how we're sharing this information so that, say, obesity prevention programs and things like that can take a family based approach to the work that they're doing.